getting a cancer diagnosis can be so overwhelming for you, for your family. There's lots of questions that come up, of course. I think the first bit of advice I would give is to learn as much as you can about your cancer and the plan of care that providers are proposing to you. Having a place where you can put your questions that are going to come up at all points during the day, not just during your visits with the providers. A notebook that you keep with you all the time. Some people choose to put those questions in a note section of their phone. You can even sometimes find pre-made questions that you can print out and bring along with you if you're having difficulty coming up with them. Also, bringing a family member to your visits with your physician can be very helpful. A second set of ears to hear what they're saying and help you interpret that and hang on to that information, especially when you're probably under, again, a lot of stress. That can make digesting information and taking in new information really difficult. Reading about your type of cancer and treatment can be really helpful. You just want to make sure you go to reputable websites so you can get those from your providers. Just going out and doing general searches is really not a great idea. There is so much about cancer treatment that's tailored very much to each individual patient, and you can get into some confusion if you start to go out and just do general searches on places that aren't really very reputable. I think during the whole process of learning about your diagnosis and treatment, make sure that you're not doing only that all the time. Make sure you're taking breaks, keeping up with things in your life that you're able to enjoy, friends and family and hobbies that you can continue to do, taking time for relaxation, distracting yourself. That's really important. As far as getting organized, that can be really, really helpful and help give you a bit more of sense of control of what's going on. Keeping things in one binder, in one place, medical bills, questions that you're going to take to your provider, information that you may gather, keeping it all in one place, whether physically or even digitally on your computer, is really helpful so it's all in one spot. Also, prioritizing things that need to be done. There's so many visits. There are paying bills. There's gathering information, maybe on family history. So much information that you're trying to get, and so many tasks that you have to do. Trying to prioritize those can be really, really helpful in making things feel less overwhelming, so you know exactly what's coming up next, even though things may change from time to time. Putting the contacts of your healthcare providers and those on your team in your cell phone's contacts can be really useful so that they're with you all the time and you're able to get to them easily and share them with others who might be helping you, like friends or family. I think also making a plan for you and your family, just from your end of things, the things that are under your control, like your schedule and who's going to help maybe provide transportation for you if that's ever necessary. Making sure that you have a list of tasks that may be helpful for others to help you with. There's always people that come into your life and say, hey, what can I do to help you? What I often recommend to my patients is to keep a list of those things that would be helpful. Running to the dry cleaners, picking up groceries, or leveraging a grocery delivery service. There's just anything that could be done by someone else. You should tap into those resources and say yes to those people that want to help you. I often tell my patients, gosh, have you ever helped somebody? And that feeling that you get of being blessed by helping someone else, give that opportunity to those in your life that are offering to help you. But again, it's really great if you've got a list of those things ready to go so that you can give them something that's tangible that they can do for you. I think those tips are the ones that may help, again, make this feel less stressful and overwhelming. And, even though you're in a situation that's just going to feel stressful for a while, probably.
A lot of patients find that at the end of their treatment period, when they're completely finished with all the treatment, that their friends and their close family members may be expecting them to be happy about it and to just move on from there. And a lot of people actually start to process everything that they've been through at the time that they finish all of this treatment. So some of the things that you can be aware of right away are, number one, make sure that you choose the people from your family and from your group of friends that can be supportive and can listen to you about where you're at that time. That aren't just going to try and tell you, just shake it off. They're going to actually help you process it just by listening. The other thing to keep in mind is that it doesn't always have to be a family member. It's perfectly fine if it's a friend or even if it's a professional that helps you through this period of time. Practice mindfulness and journaling on a daily basis. And by mindfulness, I would say that's just basically paying attention to everything around you in a new way, in a new, more specific way in your listening, you're seeing, tasting, smelling, you feel, you use all your senses, and you actually are aware of where you're at in time and space. And that, along with journaling on a regular basis, have been proven to really help people that are going through a stressful time. Do some activities that bring you joy. These can kind of help you stay distracted from worrying. And then remember to give yourself grace. This is something I would explain as saying, treat yourself as if you're treating your friend. Give a little bit of slack. Don't expect extremely high expectations for yourself. So just be kind to yourself and go through it as it comes. Take one day at a time. Cancer Care has free one-on-one counseling that's available. It's over the telephone, but it's with licensed counselors or a social worker that can help you work through this feeling that you're having a lot of stress and maybe help process some of the feelings you have left from treatment. And then talk with your doctors. If you're feeling sad or down or depressed, it's fine to go ahead and talk to your doctor about this. This is a part of your health just as any other side effect. And for that matter, if it would help you, you have available to you professional counselors, professional psychologists, and you can either get a referral from a doctor or you can go through online and look for the type of counselor that you would like to talk to.
Nurse navigation, I feel like the importance for patients, the value for patients is that we are an advocate. We can help you to get through the often disjointed system of healthcare and giving you guidance along the way. Barriers to care that might come up, we hope to help you get around those, under them, through them, with our understanding of the system and helping connect you to support and resources. I often tell my patients, think of me as, if this is a flight you've just gotten on and you really don't want to be on this flight, of course, think of me as air traffic control with a little bit of flight attendant mixed in. That's what I hope to provide for patients. It's truly my honor and privilege to walk alongside a patient through this journey.
Nurse navigation really is removing barriers from between where the patient is and where the treatment can be had. And that comes in a lot of ways. So as Brandy mentioned, it's really important that the patient have an advocate and to learn to advocate for themselves as well. And that's something that can come through navigation.